Hello, you guys. I am Dr. Vidal. Thank you for logging in. We're back with Tuesday Tips. We try to meet every Tuesday afternoon, discuss different topics in plastic surgery, and I get to answer your questions. Thank you so much for the continued support. I'm going to be talking today about women's health and plastic surgery. It is not an obstetrics and gynecology class because that is not my field, but there are a lot of questions when we go into the perioperative period, meaning before surgery and after surgery, regarding women's health. So I'm going to answer the most common questions, and of course, if you guys have any questions of something that I didn't discuss, I will be more than happy to go over them. So let's start with the first one, which is the most common thing that causes anxiety on patients because they come in and say, I got my period and I wasn't supposed to for the next 2 weeks or so. It is very common with the stress of the surgery that your period comes before or after. So don't be scared if your dates are not the usual cycle of yours around the surgery. And that creates an extra stressor because you weren't planning of having your period and wearing a faja and needing the massages and all this. So I understand. Don't worry. It's okay. You can go through it. Just remember to continue your iron supplements, which is very, very important, okay? To try to keep your hemoglobin level at level. And that's why it's so important to start those iron supplements, vitamin C, and all the supplements and the folic acid that we require at least 30 days before. Because we're expecting not only bleeding from the surgery, but sometimes this friend comes along and decreases also more the hemoglobin level in the perioperative period, okay? So the other important thing to remember is that during the surgery, you shouldn't be wearing a tampon. Tampons go inside of our body and that may create a focus of infection. So it's better to wear a pad. And we're gonna tell you this in the pre-op if you're in your period, but just letting you know, because if you do wear a tampon for surgery day, we're gonna ask you to remove it and to put or replace it with a pad. And don't worry, we are in medicine and in surgery, so we've seen blood. We'll be fine. It's okay. Don't worry about that, okay? So again, if your period goes before, after, don't give too much of a headache with this. It is normal that with the stress of surgery, you may see some changes, okay? Pregnancy, of course, you can be pregnant for surgery, okay? Unfortunately, we're gonna ask for an HCG in blood before, with your blood work to be done before, and that's to make sure that you're not pregnant before coming in. But things may happen in the 30 to 60 days that you did your labs before. So I'm gonna do also a pregnancy test the day of surgery. And why is this? My focus is keeping you safe, and if you're pregnant, I have to keep safe that baby. The decision to continue or not the pregnancy afterwards, that's up to you, but I have the responsibility of keeping you and if you're carrying a baby safe. Anesthetics are not safe for a baby, especially in the first trimester, unless it's an emergency, and this is not an emergency. So we're gonna check you beforehand and you the day of surgery, and if that pregnancy test is positive, we're gonna have to cancel the procedure and postpone it to whenever, whatever it is. Some people have decided to go through with the pregnancy and then we can arrange something later on, or they decide to terminate. That's up to the person, right? I don't go into those details, but the important thing is if the HCG in urine is positive, day of surgery, your case will be canceled, okay? So it's very, very important to be conscious about this and practice safe sex and contraceptives 30 days before the surgery at least, okay? And that goes into my third point here, which is the contraceptives. Unfortunately, majority of the contraceptives, I'm gonna ask you to stop them. And you're like, what? You just told me that if I get pregnant, you're gonna cancel my surgery, and now you're telling me I can't drink my pills. What do you want me to do? Well, I want you to use a condom or other methods of contraceptive. Hormones increase risk of blood clots, okay? And I do not want you on any estrogen medication because specifically estrogen increases risk of blood clots. So that is why we're going to ask you to stop all hormones or ACPs before the surgery, okay? So the majority of them are going to be stopped. Which ones are the ones that you can continue is an IUD. An IUD or intrauterine device, it may contain estrogen, but it's locally secreted in the uterus. So it does not go systemic in your system, so it does not pose an increased risk of blood clots. The other types of hormone supplements are progesterone. If it's only a progesterone medication, that's okay to continue. But if it's a progesterone estrogen combination or estrogen hormone, you can have it. You need to stop it 30 days before and 30 days after the surgery, okay? Yes.
It's important. What are the ACPs? She get just after
Contraceptives, yes. Okay? So the other one that it's a common one that people use is the one in the arm. So if you have the subdermal or subcutaneous implant, it's called Explanon. It is under your arm. That is an estrogen, and that needs to be removed, okay? Before the surgery, we're gonna tell you if you book for surgery and you have one, to plan ahead and go to your OB to be removed, because that one is not the same as the IUD, because that one goes systemic, okay? That's the difference. The IUD is inside the uterus, so it goes just to the uterus and not to your bloodstream. The one in the arm goes to your bloodstream, so it increases risk of blood clots, okay? Breastfeeding. So if you are breastfeeding or are planning to breastfeed in the future, those are two different things, right? Let's start with if you're breastfeeding now or you breastfed in the last few months, you should not have surgery, breast procedure, okay, for the next 6 months. What if I'm having a BBL and I'm breastfeeding my baby now? Can I still proceed with the BBL? My recommendation is that you shouldn't be breastfeeding with the BBL or any surgical procedure. And the reason for that is a couple of things. One, breastfeeding is a metabolic demand in your body. You're producing milk, so you're producing calories to give to another human being. During the post-op period and surgery recovery, you need all those calories for you to heal, okay? I don't want you kind of dividing those calories that you are kind of producing for the baby and healing at the same time. So you're not gonna be in the place in your body to be giving to another human being. So breastfeeding, you should stop it before the surgery, even if you're not doing a breast procedure. And the other one is because a lot of the anesthetics and pain medications that we're gonna give you are contraindications to pass through the milk. So if you're breastfeeding, you're gonna have to pump and dump or get rid of that milk because it's not safe to give it to the baby anyways in the early post-op period, okay? So my recommendation is to stop, like if you're planning on having surgery, you should stop before. If it's a breast procedure, definitely 6 months before, okay? What if I'm having a breast procedure now, but I don't know in the future if I wanna have babies and I wanna breastfeed? The majority of the breast procedures and breast implants are not contraindications to breastfeeding. So that means if you're having implants done and you're in your 20s, for example, and you then have babies in the future, you can try to breastfeed. That is not a contraindication. And the majority of patients that have breast surgeries, breast reduction, breast lifts, breast implants are able to successfully breastfeed in the future. What is the reality? The reality is that there's like a 20-30% of people that after a breast procedure are unable to breastfeed. It is very hard to tell that if that percentage of people weren't going to be able to breastfeed their babies in the first place, right? So there's no comparison on that because there's no way to check that, right? There's people that can't breastfeed even without a breast procedure, right? So there's that. And the second one that it's important to, that I always tell my patients that get a breast reduction is that the majority of patients that have a breast reduction and then breastfeed in the future would need to supplement with formula. That makes sense because I'm removing breast tissue. So the amount of breast ducts and milk that it's left behind is not gonna be the one that you had from birth. So you are gonna, the majority of patients then can breastfeed, but they don't produce enough milk to supplement completely 100% breast milk to the baby, and then they supplement with formula, okay? So if that is something that is extremely, extremely important to you, then you should wait having babies and then have your breast procedure. But for the majority of my patients, that is something that I explain and they're okay with just knowing what are the possibilities, okay? But it's definitely not a contraindication. And last but not least, the mammograms. So who needs to have a mammogram before the surgery? So anyone over 40 needs to have a mammogram before a breast procedure. Anyone above 40 should be getting a mammogram for screening purposes anyways, okay? So if you're having any other surgery, it doesn't matter. You should go and check yourselves. We as women are very, very prone to leave ourselves and not take care of our body, and we're making appointments for the kids, for mom, for dad, for everyone. But if you're over 40, this is a quick reminder, you should get checked for breast cancer. So you should go get your mammogram. But if you're getting a breast procedure, definitely, I'm not going to do a breast procedure unless you have a mammogram within a year, okay? So let's get to some questions now.
How can out-of-state clients schedule a consult? Patients, I say.
Yes, very, very easy. You go to our website. If you're in my Instagram or in my TikTok, you go to the bio. I have a link in bio that you can click it and it'll direct you to the website. If not, it's very easy. It's pureplasticsurgery.com. If you go to the website, you'll see a link that says virtual consultation. You click that, it'll open up a formulary or a questionnaire regarding some like basic questions, what procedure you're interested in, and it will ask you for 3 pictures. The 3 pictures are essential for me to evaluate your case and determine what procedure is best for you. Once you fill it, it's not immediate, okay? It takes about 3 to 5 business days because I have to evaluate the case. I then let the coordinator that is assigned to your case know, and that person will contact you with my recommendations. At that time, if you want to schedule an in-person or virtual consultation with me, that is also a possibility. Your coordinator will help you out with that.
This is a comment. I'm 3, weeks. I'm 3 posts up,
Okay.
and I've been breastfeeding since the day I got out of surgery.
Okay, I mean, just stay hydrated, okay? That's so important. We get dehydrated with breastfeeding and the calories, so you have to account for those 2 things. The calories that you're putting in, you are not only getting, like in the negative side, the calories that your body's using for healing, also the calories that you are in, like if you have nausea, if you're not eating well, those you're not intaking, and now you're giving milk, so you're taking out more calories, so your healing may be compromised. And you're giving milk, so your hydration status is going to be less. So it's very, very important that you hydrate more and you take more calories in meals, but also protein shakes to try to get you to heal well.
How long is the recovery of breast procedure usually?
So breast procedures, you are gonna feel almost like able to go back to work and do normal routine daily stuff at the house about 2 weeks in. Majority of patients are back to work at 2 weeks, but you are gonna be able to lift anything heavier than 10 pounds, exercise, or submerge in water for 6 weeks. The breasts tend to look very tight and high for the first 6 weeks. Majority of patients by 6 weeks to 3 months, the breasts drop and then they get a final result by 3 months.
Difference between breast with implants or no implants? The recovery is the same.
Yeah, pretty much. I mean, without implants, less pain definitely. With implants, it's not that you're gonna have a lot of pain, but you are gonna have more tightness and pressure in your chest because of the volume of the implant. But the recovery is very similar between them two.
The BMI for a mommy makeover, please.
So BMI max for all my procedures is 33.5. That's the max BMI for all the procedures. I do recommend all my patients to try to get to a BMI of less than 30 because risk of surgery decrease significantly when you get your BMI to less than 30 and your results are a lot better. So if you can get it below 30, that's best, but definitely below 33.5.
And last but not
Please.
okay, how do you decide whether to do silicone or saline implants?
Good question. Basically, it's a personal decision. Both are equally safe. Both are very tolerable in terms of pain. Shape-wise, they look very similar, but they feel differently, okay? So a silicone implant, the inside is silicone, but it's like a gel. So that's why they're called gummy bear implants. So they feel very soft, like a breast tissue. Saline, on the other hand, the outer part of the implant is still silicone. So I have patients told me that I don't want any silicone in my body, that's why I'm getting a saline implant. Well, it's important to understand that the saline implant cover is silicone based, but yes, the inside of it is saline, okay? The other major difference, so they feel more like a water balloon, okay? So if you have a lot of breast tissue, then you're not gonna notice the difference because the implant always goes below or behind the breast implant or muscle. So when you have a lot of breast tissue, you're not gonna notice much of a difference, but if you have like an A cup or B cup, and you're a thin patient, you're gonna notice the implant, you're gonna feel the implant. So silicone feels more natural. The other thing that's important to mention is what happens if they break. So if they break, saline, your body absorbs. So that's great because there's nothing to do other than, well, you're gonna be asymmetric instantly. So your body's gonna absorb it, so you're gonna have one side that is deflated while the other one is still intact. So the need for a replacement is faster because you're gonna be asymmetric. So even though it's people feel that it's safer, usually when it happens, people are more distraught because you're going to be asymmetrically noticeable. With silicone implants, if they break, you're not going to know, so it requires surveillance with ultrasound or MRI 5 to 6 years after you get them done, and then every 2 to 3 years to monitor for rupture. If they rupture, they're not going to be leaking silicone because the silicone is not fluid, okay? So don't be scared that the silicone is going to be like spreading through your body. No, it's like a gummy, and the majority of the implants actually stays intact and it's not like deflating. So the shape stays intact, but yes, if it ruptured, you'll need to change both of them. Okay, that's it, you guys. Thank you so much for all the questions. I think of the topics here discussed, this one is one of the most important because this one affects your recovery and increases risk of blood clots, which is very, very harmful. So I know that a lot of people, especially in menopause, are very comfortable and they feel a lot better with the hormones, but that risk is something that we can't tolerate after surgery. So 30 days before and 30 days after, stop any estrogen supplements. Thank you guys. I'll see you guys next week on Tuesday Tips. Have a beautiful day. If you're in Miami, stay safe and dry. It's raining like crazy. So see you guys next week.